Hello friends, Luis back again, and I wanted to make this video about this teenager who unfortunately and tragically passed away recently due to the COVID-19 virus. I don't know if you saw this in the news, but it was kind of shocking because the boy was turned away from urgent care for not having insurance, and then I guess on the way to get help to another hospital, he passed away from complications. And this was shocking for a couple of reasons. One, how can you be turned away in the United States for not having insurance? Number two, wait a minute, I thought coronavirus only affected the elderly. And so we're going to watch the video. This gentleman's going to be explaining essentially what happened, and then we're going to jump into how health insurance is important and what you can do to prevent anything like this from happening again. Horrible tragedy. Okay, so apparently, unfortunately, the young man didn't have insurance, so they did not treat him when they arrived at an urgent care facility. And then the medical staff told him that he needed to go to a public hospital. So that's very, very important because there are certain medical facilities that will not accept you without insurance. And what is considered insurance? We've got private plans, we've got short-term limited benefit plans, we've got group insurance through like your job, and then obviously we've got the Obamacare plan. Obviously, counting Medicaid programs like state-sponsored programs or government-sponsored programs like Medicare for the 65 and older crowd. So what was so shocking to me about this was that before I was in the health insurance industry, I did not know that you could be denied coverage, but apparently that is not the case. And we found this out the hard way. And so here's the thing. Whenever I'm looking at finding coverage for somebody, one of the most important things that I look for is wide networks. Okay, so a network is how far out you can go. So most networks are designed to kind of keep you in your home county, right? So if you are, let's say you live in Los Angeles, it's Los Angeles County, or your regional. They're really not meant to be nationwide. What what I try to find are nationwide plans that anywhere will take you. So what's very, very important is to have an insurance card that will get you into the door to the urgent care, the emergency room, to these hospitals, anywhere else. Sorry about that. And so, if you've got questions about your current plan, whether it's widely accepted, feel free to reach out. But what's super, super important is having an insurance card that shows that you have health care. Okay. And so, again, thoughts, prayers go out to the family of this young man. Super, super unfortunate. But this should not be something that still happens in the United States in 2020. It's a tragedy on so many levels, and I think that personally, it's a reflection of the healthcare system and how broken it is. But that's a whole nother subject. Like maybe I'll do another video on that. But the fact is you've got to have coverage that's really going to cover you. I'm not to be redundant there, but that's really going to cover you in a time of need. I've talked to so many people that they thought they were covered. They even got an insurance card, and lo and behold, they're denied coverage because it's not in network. So having a large network is super important. And number one is the PPO. That's the most widely accepted nationwide, sometimes even out of the country, preferred provider organization. That's what it means. Then we're going to get smaller and more regional with an HMO, home maintenance organization. And then even smaller than that is its EPO, exclusive provider organization. Super, super restrictive. Look for PPOs whenever you can. Thanks so much for your time. Have a great day.